This segment is brought to you by Busamed Paardenvlei Private Hospital.
Dr. van den Berg, thank you for joining us on Living Your Best Life.
Pleasure.
So, it's only a matter of time with the advancement in technology that we've allowed robotics to enter a theatre. How has this advancement helped in the surgical process?
Well, in orthopedics specifically, it has enhanced a lot of things for us. And first we must start with the challenges of knee replacements or knee arthroplasty. In the challenge of a knee arthroplasty, you have that there's a big patient variability. And then there's a great variability in the size and the position of the femur. And then there's a variability in the joint line. To accommodate all these variances of people with one single recipe, you can run into dissatisfaction. So therefore we find that in knee replacement arthroplasty there is satisfaction of 80% of patients, but 20%, if you ask nicely, aren't actually very satisfied with their knee replacements. With the patient variability, you come to the new robotic technology, and of which Navio is in the forefront of a robotic handheld technology. So it's a fantastic platform where you actually have the handheld tool in your hand like this, and this burr can only do what you plan. Mm-hmm. Therefore, on the execution side, you have a robotic assisted platform that does the work you plan, but not what you did not. It stops when you go out of the zone where you did not plan. It's all about data collection. So if you have data collection, you look at the x-rays, you assess the x-rays of the patients beforehand and see what they look like, look at the different angles that are applicable, and then you come to the live surgery part where you actually collect the data real time on the table. You don't need an MRI beforehand, you don't need a scan, all the data can be collected by the computer stroke robot while you're operating.
So how do you get the data?
If we then have a knee, and a normal knee has its own axis of movement, so we call that the functional flexion axis. So each knee has its own unique axis where it wants to move. And then each knee has its own specific joint line, which is there, which can be from 0 to 9 degrees. So that would be then the happy zone where the soft tissue is at the right tension. So if we come to data collection, we place 2 pins in the femoral, in the femur, and we have our arrays which can pick up movement by this laser beam from there. On the tibia side, we also have two pins with 4 arrays, and between them, picked up by the laser, the computer robot assimilates the information. So then we start off. If we start off, we can see the arrays there where it's visible, the femur, the tibia, and the handheld instrument. And then we can take the leg through a range of motion, and we can use a wand to actually paint the knee so that we have a 3D picture of it.
So whilst you're doing your checks, is robotic assisted surgery used in all knee replacements, or is it on selected patients?
It would be all knee replacements, but it is used in selected patients because of number one, there are medical aids that prevent us, or in which it is prohibited to do, because it does add a little bit more time to it. Secondly, if there are contraindications, for instance, if the patient has a bad skin, you don't want to put pins into a bad skin area, or if the patient is excessively overweight, going through a lot of fatty tissue is also, or adipose tissue, it is actually contraindicated, you don't want to do it. So, but for the rest of the patients, we use it for all our patients. So now we come to the execution part of it. So here's your handheld robotic tool, and this then, as you can see, moves around, and then we can come to the femoral part and actually burr away the bone. I'm not going to do that, I'll just show you how it works. Is if you then come, it burrs, and then you burr away the bone, and then as you burr, as you burr away the bone, it goes onto the green, and then that's 5 millimeters, 3 and 2, and then white is when you're on the exactly on the level you want to be. So per millimeter, you are taking away exactly the amount of bone you want to take. So there we have the exact amount of tibia that needs to be cut off or needs to be resected. You can do it in one of two ways. You can either use the machine, we can use the machine here, and then again burr it away until we down onto the white, or you can put a cutting block over there and cut it with a normal saw. And it will only allow us to do what we plan. So as you go out of the zone of planning, it stops turning.
So my understanding is that robotic-assisted surgery allows for precise surgery.
That is exactly it. To the millimeter, robotic-assisted surgery allows you not only precise planning, but precise execution of the surgery.
Perfect. Well, thank you so much for joining us today on Living Your Best Life.
Thank you very much. It was great.
Busamed Paardevlei Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Busamed Paardevlei Private Hospital offers their patients and their visitors the ultimate Busamed experience. Premium care, personal touch,